Hi, I'm Dr. Richard Ruling, a board-certified internist and had a year of cardiology before teaching at Loma Linda University in the School of Public Health. Health science was my topic, and I have something very interesting to share with you. True story, really, and sad story. My wife and I, nearly 20 years married, living in the D.C. area, when she got a bladder infection. And it was real trouble for her, had burning, frequency, urgency to go, and didn't know what to do, drank cranberry juice, drank water, ended up going to see her doctor. Didn't know what else to do, but he prescribed an antibiotic for a urine infection, and she didn't abuse it, took it a few days, was better and quit. But about 6 months later, she developed spots under her skin. And she went to see him, and he did a blood test and called urgently the next morning saying that she needs to see the hematologist. And the fact was that she had a platelet count that was about 1/10 of what was normal. Should have 100,000 to 200,000, and she had about 20-some thousand. And bottom line was that her platelets were wiped out from her bone marrow. And she had a series of treatments, a splenectomy where they took care of the spleen, gave her high steroids, gamma globulin, blood transfusions to give her the platelets, but she died of a stroke. And that was in spite of the best medical care. She was even in the hospital where the man wrote the book on platelets, but couldn't save her situation. And the fact is that you think, well, this would never happen to me. You know, we look at the numbers, but the truth is, prescription drugs are a leading cause of illness and death in this country, bigger than most people realize. And I'm going to give you the statistics now. I do have a website called Leading Cause of Death, prescriptiondrugs.com, and these figures are from the medical literature there cited. The JAMA, Journal of American Medical Association, reported on tax day, that's April 15, 1998, that 106,000 deaths in hospitals occurred as a result of these adverse drug reactions. And the definition is it's not an overdose, wasn't the wrong medicine, wasn't malpractice, it was properly prescribed and administered. So it's just that that chemical reacted with that person in a way that would not be expected. And that's 106,000 in hospitals under monitored conditions. 2 years later, the Western Journal of Medicine, in June of year 2000, reported 199,000 deaths outside the hospital. So the first study was in hospitals. The second study was how many died at home. And you put them together, it's 305,000 deaths. Okay, and that particular article listed a lot more other problems. For every person that dies, there's about 144 that have a bad effect, see their doctor, some of them going to emergency rooms, some of them being admitted to the hospital, and many who end up going to nursing homes because they're messed up for life. And bottom line, not good situation, but that was the result of studies that's nearly 20 years old from facts then. From the year 1998 to 2005, it was a 7-year period, the bad effects, bad illness, severe reactions increased 2.6-fold, and the deaths increased 2.7-fold in that 7-year period reported. It was studied till 2005, but reported in the Archives of Internal Medicine in September around 2007. So bad situation. And if you go another, up to our time, that was a 7-year period that the deaths increased. By the way, I should tell you this, that it was Congress who approved the drug ads in the fall of 1997, just before the first thing came out. So we might take it as before drug ads began on TV in such a big way. We can see that it was about 305,000. But the increase is due to the drug ads. Okay, and Marsha Angel, MD, editor of the New England Journal of Medicine, now teaching at Harvard, by the way, decries the drug ads on TV. She told 60 Minutes that Congress spends about $400 million a year in different ways, often a donation to their re-election campaign for these Congress people, so that it's a bad situation. I personally took this medical literature that I'm citing to you to visit senator offices. And I was going through these offices until one day a senator said, you know, you're wasting your time. They own us. Well, Congress is sold out. They don't really, you know, they are false to their oath of office to protect Americans and people as they should. They're just more interested in their re-election and getting money from the drug companies. So bad situation overall. And but I have good news for you. I was teaching health at the School of Public Health at Loma Linda University when I attended a cardiology convention, and Nathan Perdican reported how his diet and exercise program got 85% of people off of their blood pressure medication. Similar numbers for diabetic medication. And that's good news, because diabetes is a huge problem affecting nearly a third of all adults now. So his diet was excellent, and an exercise program. And I've had excellent results with patients. One, I think, of Salvatore Frascinella, who attended a seminar series that I gave. And by the way, I'm going to be giving you an opportunity. This is, can you see that? New Start, Nutrition, Exercise, Water, Sunlight, Temperance, Air, Rest, and Trust in God, or Trust in Nature. Those are the true remedies that we need to have. If we can do them right and balanced, the body will repair itself. That's how heart disease is reversible. In fact, a 60 Minutes TV interview with a cardiologist, he said that 90% of people who came to him did not need the bypass surgery. But people are still laying down for this operation that costs more than $100,000. And it's costly on the body, too. A lot of stress, and not everybody has a good outcome. Whereas if you do what I'm talking to you about, it is a good outcome. Nature, you know, from the day we were born, what we've put into our mouth in terms of food or chemicals is making us what we are. If we got a problem, we did it to ourselves. And the good news is we can reverse that if we are willing to make some changes. You know, the right kind of diet, you're looking at somebody that's will be 76 in March. And 76 is I'm healthy. I have a hill behind my house that I jog every day or so. And I just say, hey, life is good in retirement if you have your health. But I wouldn't bet on the prescription on TV that says ask your doctor. That's a dangerous thing to go. That's what happened to my wife. And I would just say, hey, we can do better than that. Please go to my website. It's richardruling.com. My last name is spelled R-U-H-L-I-N-G, richardruling.com. And you can get these materials that I have. I have a couple books and a couple CDs and a DVD. Best material. One of these CDs has the best of the best on the internet. There's Dr. Amen, who he's the best-known neurologist, psychiatrist in this country. Change Your Brain, Change Your Life. He's a New York Times bestseller author. Dr. Barnard, Neil Barnard, on how to attack diabetes and reverse it. He wrote the program for it. And Colin Campbell, Diet for Cancer. He wrote the China study, etc., etc. These guys, Michael Greger, humorist. Joel Furman, excellent, been on Dr. Oz. Those are the people that are on one of my CDs, and I have the other one on New Start, and how you can use it for breaking addiction or attacking any health problem. You know, what we've talked about today, you'll forget about. The forgetting curve in an hour is that you'll know about half of what I've told you right now. But if you get these CDs, you can do better. And so the package there is worth about $100, but it's really half price, $49. Take a look at it. If you value your health and can afford the $49, get it today, richardruling.com. Thank you for giving this a look. God bless you.